Thanks for staying with CN2 today. We're here in the studio for Piedmont Medical Center today, and we have Dr. Paul Diegidio here joining us. How are you doing?
Excellent. Thanks so much for having me on.
Oh, yes, of course. So today we're talking about Piedmont Medical Center in the fall is coming out with a program, Breast Cancer Reconstruction Service Line, which is really, really awesome. And you are here to talk about that. Before we get into that, tell us a little bit about yourself.
Sure. So I'm a plastic surgeon, did general surgery training at University of South Carolina in Columbia, and then plastics at University of North Carolina in Chapel Hill. Started South Charlotte Plastic and Aesthetic Surgery over in the Blakeney area, and very exciting. It's actually this morning I got final confirmation that we will be opening an office at Riverwalk this fall.
That's awesome.
We'll be right in the area, right down the road.
That's great. So talk a little bit about breast cancer reconstruction, exactly what it is and how do people know if they're qualified for it?
Sure. So over the last couple of months, back in November was the first time I met with Mark Nosaka at the hospital and some of the administrators and started talking about getting the program up and running. So for the last, I guess it's been about 9 months now, we've been going through the process. I've been meeting with all the providers in the area that I can, general surgeons, medical oncologists, radiation oncologists, nurse navigators, anybody that would be either directly or indirectly involved in the process to try and make sure it's a smooth transition. Breast cancer reconstruction has been shown to be a very important part of the process for breast cancer care. Women who have breast cancer or who have breast reconstruction after breast cancer have better outcomes in terms of body image, lower rates of depression. It can be a very helpful and powerful thing.
And talk about, you know, when it comes to insurance, people may steer away thinking it's too expensive, but is it covered?
Absolutely. So in 1998, it was the Women's Health and Cancer Rights Act was passed by Congress. And the bottom line is insurance pays for breast cancer reconstruction.
That's amazing.
So anybody who has that diagnosis of breast cancer, it will be covered. And then in 2015, they put out the Breast Cancer Patient Education Act, which was an educational campaign to make sure that people are aware. So if you are seeing a surgeon or have that diagnosis of breast cancer, that you will be referred to a plastic surgeon so you could discuss your options.
And what are your options when it comes to reconstruction if you go down that path?
Sure. There's a wide spectrum. From a timing standpoint, there's both immediate and delayed. If you're having an immediate breast reconstruction, it means that when you go to sleep to have your mastectomy, you'll wake up with at least a significant part of your reconstruction performed. So that's one surgery, and that can be very powerful, especially for people who don't want to have two surgeries or have a mastectomy somewhere and then say have to go to Charlotte or Columbia to have their reconstruction done. So being able to offer that locally is a very critical part of the process. Wow. You can also have it done delayed, which means that weeks or months down the road, if you just don't want to have to deal with that up front, you can certainly do that. There's a variety of different methods using autologous, which just means your own tissue with flaps or doing fat grafting. The other option would be implant-based. We have some examples of what that could be, what that could look like. So this is a tissue expander. So this is deflated, and I'll hand you the inflated one. So we gradually fill this up with saline, and over time that will expand the breast pocket so that it will take an implant. And you can feel, if you squeeze that, you can see it's pretty firm, it's reasonably heavy. It can be a little uncomfortable at first until we exchange it for the final implant, which you can feel this is lighter, and you'd probably agree feels a lot more like human tissue, fatty tissue, as opposed to the expander. So then we make that exchange a few months in, and that would be a version of an implant-based reconstruction.
So a lot of options. Patients definitely have options. And if you know, someone is seeing this, what is the best way to get the journey started? Who should they get in touch with?
Sure. So if you already established care with, say, a general surgeon, they can certainly do that referral. You can visit a number of options just by Googling, but if you come to, if you want to do something locally, you can go to our website, scpforme.com. Or you can email us info@scpforme.com, and we'd love to answer any questions or let you know further what your options are or start to work with you in the process.
I think it's amazing that you're bringing it here locally to people in the York County area. What does that mean for you to be able to do that?
I think it's really special. We did a study a few years back at UNC that showed that if women had to travel more than 10 miles to get breast reconstruction or to see a plastic surgeon, they were less than half as likely to do that.
Yeah.
So to be able to do it locally right here and work with hospitals and to see the wonderful patients who are already here and to provide them that service where they don't have to travel, I think is really a special thing.
Very, very neat. Well, again, the website's on your screen if you want to get in touch. And again, that service is coming in the fall, so we'll be giving you more details as it gets closer. And today we're talking with you about breast implant recalls. So let's talk about that just a little bit.
Sure. So within the last week or so, there's been a lot of movement on this front. The FDA requested that one of the implant manufacturers, Allergan, voluntarily recall their BIA-ALCL implant. This is a textured implant. We do have an example of this as well.
Okay.
This is not specifically that one, but you can just compare it to the other one. You can feel that it's got a rougher surface.
It does, yeah.
Now this provides benefits in terms of some complications with capsular contracture. It provides a form-stable implant so it doesn't move around quite as much. But over the last couple of years, both industry, researchers, plastic surgeons like myself, and the device manufacturers had noticed an increase in something called anaplastic large cell lymphoma, which is a subtype of a malignancy. It's a cancer that seems to be related to having textured implants. At this point, of the 3 manufacturers that make textured implants, only one of them has been recalled, but it's a locally aggressive cancer that over time can start to go to lymph nodes or other places. So it's definitely important to try and take a look at that.
What should you do if you do have the textured implants? What should you do about that?
Sure. Yeah. The first thing, the overall message that both FDA, the manufacturer, and plastic surgeons want to get out is don't panic. It's the incidence of this is very, very rare. It's anywhere from 1 in 1,000 with the textured implant to 1 in 30,000. Textured implants are not that common. Usually when you have an implant placed, you get a little card that'll say exactly what implant you have. And if you have a textured implant, it is still not a very common occurrence to have.
And what would be the treatment? I mean, would these women have to go through another surgery if it's the case?
Sure. So the treatment, usually when you first come in, we'll start with a workup with an ultrasound. We can draw some fluid and send that for specific cell stains like CD30, and that'll tell us exactly whether or not this is the lymphoma or not.
Okay.
Thankfully, it is very treatable.
Okay.
Taking out the implant and the scar tissue around it treats the vast majority of these cases. It's curative, no additional chemotherapy, radiation, anything like that.
Well, that's amazing.
Yeah.
But if they do not have the cancer or there's no signs of it, will the implants still be taken out just to be on the safe side?
So at this point, they are not recommending any prophylactic removal.
Okay.
However, 48 hours ago, Allergan did announce that if patients were just uncomfortable with this information, they wanted to have them removed, that they would pay for having the cost of having the implants themselves exchanged. There may be some other fees with facilities, anesthesia, surgeon fees, that sort of a thing. But if that is concerning, you can certainly reach out and speak with a plastic surgeon or at least start the process with your primary care doctor about starting that.
Okay, that was my next question. Who should you contact if you maybe see this and have those implants?
Sure, absolutely. You will probably get referred to a plastic surgeon sooner rather than later.
Okay.
Dealing with breast disease, there's a lot of people that do that. General surgeons do a lot of breast disease, surgical oncologists, but when it comes to complications related to a breast implant, that is specifically a plastic surgeon problem, and we take care of that. We take ownership of that. So you can get in touch with a local plastic surgeon. There's a couple of regional hospitals, but any plastic surgeon should be able to appropriately triage and treat this condition.
Okay, very, very interesting stuff and stuff to keep in mind. Thank you so much for coming in and speaking with us today
Absolutely.
about all of this. We appreciate it. Again, the information is on your screen if you would like to get in touch with our doctor here we have in the studio.
Piedmont Medical Center today is brought to you by Piedmont Medical Center.